for joining me. Tell me a little bit about your practice and what you guys serve.
Sure. So I started Apex Men's Health Clinic about 6 years ago.
Okay.
And I did it with the goal of just getting guys to start taking their healthcare more seriously. There's a lot of guys out there that never go to a primary, never get screened for any processes that can crop up as you get older. And therefore then 18, 20 years down the road, they have a heart attack or a stroke and think, what the heck happened? I was healthy all these years. Well, the fact is you had some problems before, just never got caught.
Yeah.
So I wanted to create a system that would get guys to come in at least once a year, get screened for medical issues, and then be a resource for them the rest of the year if anything did crop up. And so, guys, we can think of a lot of excuses on why we don't go to the doctor. And so I tried to think of those reasons, the biggest ones, and try to address those to make them smaller, lower barriers to get them to come in more frequently. So the 4 biggest reasons I thought of was the cost, the care, the convenience, and the confidentiality.
Okay.
So I tried to use my clinic to address those, to, like I said, make them smaller issues. So from a care side of things, I made mine direct primary care.
Okay.
Direct primary care is kind of a membership model of healthcare. It's not an insurance-based one. So now it's just one fixed cost and the guy gets all the care that he needs. It eliminates that issue of, I can't afford it.
Yeah.
It's already a budgetable expense. You've already paid for it. Now use the service type of thing.
Yep.
Also with the care side of things, for direct primary care, it's you don't have to worry about a bunch of patients on your roster. It's you can just take really good care of a smaller number of guys rather than just good care of a lot of number of guys.
I love that.
So I have a fixed number of patients that I'm planning on taking, just so I eliminate the frustration with corporate medicine of I can't get in for 2 or 3 weeks down the road, or I call and leave a message and I never hear anything back. So my goal is always get somebody in same day, next day, for an appointment if need be, and answer all their questions back the same day.
That's amazing.
The convenience, that goes with direct primary care as well, because I don't have as many patients on my roster, is that I don't book myself out every 15 minutes, so therefore there's room to get people in a timely manner if need be. And then the confidentiality is because I wanted to serve just one specific population, and that's guys. No offense to you ladies, but you've got your own primary care doctors, right? And kids have their own doctors or pediatricians, so there's not really a guy specialty clinic, and that's what I always wanted to do.
Well, that's such a cool concept, and so many different pieces we can kind of dive into, but what's your reason for wanting to start the clinic?
Well, I have 3 big goals for why I wanted to do this. Number 1 was to be my own boss.
Yep.
Number 2, make the same amount of money as if I did just a corporate job. And number 3, have more time to do the things I want to do.
Okay.
So when you work in the corporate environment, they tell you your schedule.
Yep.
They put your productivity quotas in.
Yep.
I wanted to just be able to do more things in the community. And so since I've been at Apex, now I coach 2 of my boys' soccer teams. I serve on the couple of boards, and I get to be at home when I need to, so I never have to miss their practices, school programs, games, nothing. I get to be a good dad to them.
That's incredible. Well, and not only do you get better quality time at home, but better quality time too with your clients and your patients. Tell me, how long does a typical visit last with you?
The initial consultations I mark out an hour for that time. And that way it gives me plenty of time to ask questions to them, they can ask questions to me, and we can kind of get everything set at once. My annual exam appointment's also a 1-hour visit, where most corporate medicine providers, it's about 15 minutes per visit. So I don't want anything to be rushed or hurried. I want the patient to feel like they're a priority. Just regular office visits, usually 30 minutes.
Okay.
Just mark out just enough time that we can take care of everything. We don't have to be rushed or hurried, and people aren't waiting for me to be seen. And it's usually a momentous occasion if there's more than 2 people waiting in my lobby. And I joke around, I say, I don't know why I have 3 chairs sitting out there, because nobody's ever waiting in them. Usually the patient comes in and they're ready to go back immediately.
Gives them a good choice.
Yeah,
That's
I guess.
Excellent. Well, tell me a little bit. So one thing you touched on is confidentiality and having a space for men to come into. It's such a cool concept, and it's brilliant, but at the same time you touched on kids having their own space, females having their own space. How did you come up with that concept to create a space for men only, but also where they feel safe and secure and trusted in their healthcare?
So I actually spent some time at a men's clinic here in town, and about 6 years ago was when all the men's clinics were popping up, and they were all out of just testosterone kind of focused clinics, which is fine. That's kind of what they wanted to focus on. It didn't work out for me there. For a variety of reasons, but I saw the need at that time that a lot of guys were coming into the office for a new consultation because they hadn't been to the doctor in years, like I said. They seen these ads on TV or heard them on the radio and said, oh, that sounds like me. I probably just need some testosterone. So they would come in, I would screen them, and they would have all kinds of undiagnosed medical issues like sleep apnea, their cholesterol would be through the roof, their blood pressure would be off the charts, they had diabetes or thyroid problems or what have you that they had no idea of, and they just thought they just needed a shot type of thing. And it's like, we got more we can focus on here. So
look at the full picture.
That's what I wanted to create. Some shop guys just knew that's who I go to if anything goes wrong.
I love that. So tell me, if, let's say, people are coming into you or they're interested about getting started at your clinic, what's the process to become a patient of yours?
Pretty simple. Come in for the initial consultation, which is free. We sit down, I hear what you're interested in, what you're looking for. I tell you what I do, why I do it, and we see what happens next. If it's a good fit, we can move forward with membership. If not, you're not out anything but just a little time out of your day.
That's excellent. Well, and to get more education too about your health and well-being and how to improve it. So you talk about membership. Do you accept insurance at all? Does it pair with your insurance? What does that process look like?
I'm pure direct primary care, so meaning I'm not in with any network, in network with any insurance providers. That means that it's all just out of pocket for the patient. And you think, well, that sounds terrible, but now insurances aren't like they used to be. And deductibles are in the thousands of dollars, premiums are all-time highs. They just don't pay for regular office visits anymore. And so this type of medicine actually pairs really well with high deductible type plans that are more like catastrophic plans, to be honest. I mean, you still need insurance because if you get into a wreck or you get an appendix that attacking you or you gotta have some sort of emergency surgery, you need that coverage. But this is a great way for those individuals who have those high deductible plans or maybe no insurance coverage to at least get some care and to get covered for the basics, basically.
For sure. Well, and you talk about it at a cost savings, but the quality of service that you're getting is you get triple the amount of time as you would an in-network service, which is an absolute benefit.
Yeah. I have all my patients download an app that's HIPAA compliant that they can text me with. And so it's so much more convenient for them to not have to call the office, play phone tag, wait for calls back. It's just text me and then I text them back as soon as I can, and we can get a lot of things accomplished via that. So it speeds up the process of getting their problems addressed.
That's incredible.
They like that.
So for payment then on the membership, do you have to pay it all up front? Do you get to space it out over a year? What are the options you offer?
Just a month-to-month basis. So they come in, they sign up, and they can cancel anytime. I don't hold anybody to a long-term contract. And
that's amazing.
Yeah, if they like the service, they'll stick around is the way I see it. So
that's incredible. Well, tell me location of your clinic. Where are you at here in Omaha?
We're on 78th and Dodge. That's where we started. We'll be there for a while. It's very convenient. It's right on Dodge Street, close to the interstate. So just north of it between Cass and Dodge Street, 78th and Wakely.
Okay, sounds good. And then do you have any staff that are a part of the Apex team?
I do, yep. I've got my assistant. His name is Jalen. He's my right-hand man. He comes in, he'll draw blood, he'll do vital signs, he schedules the appointments, answers the phones, does everything in the clinic, lets me focus just on patient care, which is nice.
That's excellent. Well, to have a catch-all like that person is so helpful and a really value add to your entire clinic experience as well.
No doubt, yep.
Well, that's amazing. So any advice or maybe if there's a male out there watching this and he hasn't been to the doctor in years, what would your advice be to him, or maybe what is a good reason to come check you guys out?
So my advice is for any age males, it's never too late and it's never too early, because now diseases, processes are starting to show up at younger ages. So it's good to get some even just baseline labs, get a baseline exam even before you're sick. That way we have something to compare to when something does crop up. Or if you're already an older gentleman and haven't been for a while, it's not too late to come in now, because there's still things that can be done to help keep things on the right track for the future.
That's good to know. And then give your clinic a call, visit a website. What's the best way to contact you?
Either one, yep. Our office number, or you can visit our website. There's even a contact us link on that you can, it'll email me and we can set up appointments via online and make it pretty easy.
Okay. And then that free consult, you said, how long does that last?
It's an hour-long appointment.
Okay. Well, excellent. Thank you so much for sharing about your clinic. It's lovely to get to know you.
Likewise.